I think a lot of people pursue a subspecialist when it comes to certain problems like rotator cuff tears because of arthroscopic surgery. Minimally invasive incisions will allow for quicker recovery time and, in my opinion, a better technique overall. My name is Brandon Horn. I'm an orthopedic surgeon at Witham Orthopedic Associates. I focus on shoulder and elbow reconstructive surgery. I specialize in arthroscopic rotator cuff repair and arthroscopic procedures around the shoulder, as well as open total shoulder and reverse shoulder arthroplasty procedures. I think the shoulder is a complex joint because it has multiple planes of motion. It's a small socket with a large ball, which is different than in many other joints because it's really reliant on muscles and tendons for stability and strength. And there are a lot of pathologies and problems that can occur in and around the shoulder. As we're moving, the rotator cuff, which are the muscles around the shoulder, are important specifically for certain motions and certain planes of motion. And if those become inflamed, torn, compromised in any way, those are certainly problematic for people, especially when it comes to overhead activities or activities of daily living, and it can be very painful. You can have limitations to motion, weakness, pain with certain activities, and those are the types of things that I have the ability to affect and the ability to improve upon. Patients that present to me with pain are looking for an answer. They're looking for a solution that will help them to get back to a normal function or maintain activities of daily living as best as possible. And whether that's a conservative versus surgical treatment, I think that's the approach that we try to work together to find. In the post-operative setting, initially we're trying to allow things to heal back. We're trying to get tendon to heal back to bone or implants to be in the appropriate position and to heal in. But we're also trying to avoid stiffness and the early inflammation that can occur. So we're finding the appropriate motions that don't stress our repairs but allow for early motion and a good long-term result. I think the keys in the after-surgery setting would be recognizing that there's a balance. We're trying to find a balance between healing of whatever's been affected during that surgery, as well as finding that early motion ability. And that's why I think it's important to have a good relationship with your doctor and be able to discuss the appropriate grading and therapeutic stages of rehab. I think the best part of our job would certainly be creating a diagnosis and being able to follow through with that, and then finally seeing patients improve, whether it be just simple activities of daily living, overhead motion, returning to work, or being able to do something as simple as pick up a grandchild, which they haven't been able to do for a while.